Ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. My name is Santi Indra Astuti. So today I would like to share to you about my paper here titled Infodemic of COVID-19 in West Java Province, Theme, Pattern, and its Implication. As co-authors of my paper is Ratri Rizky Kusumalestari and Rita Gani. Three of us are from the Faculty of Communication Science, Unisba, Indonesia. COVID-19 outbreak, as we all know together, is not only a pandemic. Along with the vast and the rising amount of information, there are also unclear information widely spread and shared among people. The director of WHO, Tedros Adhanom Ghebreyesus, during his speech, has stated that we are not just fighting infodemic, we are not just fighting epidemic, we are also fighting infodemic. So this term is captured by media and quickly those media reports are centered on it, resulting in uncontrolled wave of COVID-19 related information. So the turmoil began and rocked the ecosystem of information. Now, I would like to share to you about Jabar Saber Hoax. As a result of massive campaign against hoax, Jabar Saber Hoax was established in 2017 as initiative among provincial leaders in West Java Province. As a fact-checker organization affiliated to West Java Provincial Administration, the West Java Saber Hoax has performed its duty to verify hoaxes and upload the results through several channels, including Instagram, which is most popular. Not only fact-checking, Jabar Saber Hoax also involved in public education activities throughout the province and support the Information and Communication Bureau in the province to do the task. So during the outbreak, Jabar Saber Hoax received complaints of COVID-19 hoaxes. They are also doing digital scanning, social scanning on digital environment as a step to control and doing preventive measure against the proliferation of COVID-19 hoaxes among public in their scope of area. So this research is basically carried out to analyze COVID-19 hoaxes by collecting and debunk by Jabar Saber Hoax during the first phase of the outbreak from February to May 2020. By obtaining data on theme, type of infodemic, targets of hoax, and any other details, more insights are expected to comprehend how infodemic has been going on in local scope. Hoaxes that I'm already mentioned is referred to misinformation and disinformation. So information and disinformation in social media can influence public opinion and behaviors with intense consequences, also creating false information and harmful information like malinformation. Hoaxes on COVID-19 become more than public health concern when it is strengthening the social stigma as experienced by post-COVID-19 patients, families, even health workers who treat COVID-19 patients. Infodemic came along with the pandemic. Infodemic is an overabundance of information, both online and offline. It includes deliberate attempts to disseminate wrong information, to undermine the public health response, and advance alternative agendas of groups or individuals. Mis and disinformation can be harmful to people's physical and mental health, increase stigmatization, threaten precious health gains, and lead to poor observance of public health measures. COVID-19 hoaxes is an example of information disorder on extreme measures. Until October 2020, the Ministry of Communication and Information in Indonesia has collected 1,219 hoaxes. Observing the content, hoaxes of COVID-19 is not limited on health issue. The narrative is often politicized in such a way and proceeds as which driver toward certain targets. This is not only experienced in Indonesia. Root depolarization in Indonesia contribute to this. Moreover, COVID-19 hoaxes not only creates public anxiety, but also polarize the already polarized people onto several issues. To employ as methods of the research, we employed content analysis, quantitative based, descriptive level divided to 4 categories. The first category is theme of hoaxes, which is ranging from politics, health, ethnic, even disaster or casualties. The second category is content of COVID-19 hoaxes, captures specific issue concerning the outbreak, which is ranging from behavior, medication, transmission, government policy, vaccination, and also sometimes conspiracy. The third category is type of misinformation and disinformation. And the fourth is impersonated actors that refers to those who are mentioned by the hoax. List here are government officers, foreign actors, clerics, ordinary people, public figure, and also civil service organization. Object of this research is each post of Jabar Saber Hoax regarding COVID-19 in Instagram. Period of analyze is during February to May 2020. We found 273 posts. The monthly trend here, as we can see together, is start relatively low in February and reach growing bigger, highest amount in March, where we can found 146 hoaxes and slowly going down. This profile, this amount of number is less than hoaxes that already collected by the Ministry of Information and Communication during similar period, but actually the trend is similar. COVID-19 infodemic theme here, as we can see together, focusing on March, we have disaster as the most common theme. Here, COVID-19 outbreak was framed as a major casualties. Hoaxes in this theme emphasize more on casualties rather than health issue. Regarding the type of infodemics and mis or disinformation of infodemic, we display this table to share the result to you. So we can see here that this infodemic is less than misinfodemic. However, the amount of both categories are only slightly different. This infodemic refers to deliberate attempts of misusing information. So high percentage of the disinfodemic here implied a very serious consequence. This is the table displaying content of COVID-19 from treatment or medication to human behavior, transmission, human infection, policy, and also mix and other content that was found. We can see here that regarding the content of COVID-19 hoaxes, human infection is dominated with 83 hoaxes. Okay, regarding the impersonated actors, the last table that I will share to you, we can see here that the numbers of hoaxes, which is targeting residents as impersonated actors, reach the highest. So it means that residents are subjected the most impersonated actors in the list. It implied that a significant amount of hoaxes are targeted public as well. So what we can extract it from those findings is during 6 months of the pandemic, Jabar Saber Hoax received 2,881 complaints regarding infodemic COVID-19. Around 64% or 1,855 are considered as hoaxes or proof as hoaxes. High amount of hoaxes on COVID-19 reported among locals means that infodemic also occurred in local areas. COVID-19 hoaxes are mostly health issue, it should be, but during the early month of the outbreak, the content are mostly on human infection, the wrongdoing of government policies, and ill treatment. By embellishing those contents, COVID-19 hoaxes has framed the virus infection and its consequences as disaster by focusing only on big casualties. All these hoaxes contribute to public hysteria toward COVID-19 infection. 53% of COVID-19 hoaxes as found among locals are misinfodemic, the rest is disinfodemic. High percentage of disinfodemic implied obvious deliberate intention to add the turmoil in the society. So nearly 40% of COVID-19 hoaxes in West Java province are using local resident. The local is found as the most impersonated actors. This finding is considered unique compared to the national profile of COVID-19 hoaxes, where government is subjected as impersonated actors in the national scope. So all these findings led to the conclusion on how infodemic as found in local areas are similarly harmful compared to the regional or national scope of area. COVID-19 hoaxes has framed the outbreak as global disaster by emphasizing and exaggerating the harmful effect without no cure at all. By that way, public anxiety and hysteria is amplified. This, at the end, lead to detrimental consequences such as reinforcement of social stigma on COVID-19 issues. So that's all our presentation today. Thank you very much for your attention. Question, advice, we will welcome so much. Thank you very much from three of us. Wassalamualaikum warahmatullahi wabarakatuh.